patient treatment 4.0 and connectivity catalyst for, is that a connectivity catalyst for transformation? This will be a panel discussion moderated by a colleague and a friend of mine, Emils, and a few speakers. So this panel discussion will focus on how health data related legislation, outcomes measurements, and enabling IT systems can ensure healthcare information in order to improve quality, access, and affordability. Let me begin by introducing the moderator. His name is Emil Sundjikov, and he's from a startup Coadum and Longgenesis. You also saw Emil in the previous panel discussion. Emil, please take a seat here. He's a computer scientist dedicating his skill set towards problem solving in healthcare and education, with 8 years of experience in applied research and industrial solutions development in healthcare around the globe. He received multiple academic and industrial awards, including EIT Health, GAP Summit from Cambridge University, Young Scientist of the Year 2016, and Baltic Forbes, a 30 under 30 nomination in healthcare and research. Let's follow up with some speakers. If you have, by the way, if you have seen the list of speakers in the program, there is a slight change. The Minister of Health, Ilse Viintila, is unfortunately extremely busy today because of the current pandemic, and she won't be able to join the discussion now, but she will be able to join at the end of the conference, at the end of the summit, for closing remarks. But the panel will be joined by Johanna Seppänen, the director at Social and Health Data Permit Authority of FinData from Finland. She works as a director of the newly founded Finnish Social and Health Data Permit Authority, I mentioned FinData, with the aim to institute the new authority and its functions. Hello, Johanna.
Hi, nice to meet you.
Same here. Moving forward, Ruthie Kaidar, the director of Health Industry Sector, Central and Eastern Europe at Microsoft. Ruthie joined Microsoft 6 years ago, and she's the director of the Health Industry Sector covering Central and Eastern Europe. She's an executive with over 20 years of experience in the medical devices, digital health, telecommunications, and venture capital industries. Hi, Ruthie.
Hi, very nice to be here. Thank you.
And the panel will also be joined by Rolands Lapputie, Smart Technology Advisor to the State President of Latvia since July 2019. He has worked and he's working for the State President as an advisor in smart technologies. Hello, Roland.
Hello.
All right, the floor is yours, Emil.
Thanks a lot. So there is a slight change in position, and so I would, accompany Rolands to make the environment on the stage more cozy. Before we start, we actually basically would like to thank both the Minister of Health for being in the first line of fighting pandemics, and unfortunately not joining the panel discussion, but still she will be joining the end of the discussion. Thanks a lot. And thanks for dear speakers and dear audience, both virtually and some of you being here offline. So as far as you might have noticed, so our first panel discussion today was mostly centered on patient care. So how we can create such a data system that would benefit and would include a patient as a center of the whole process of life cycle of utilization of the data and providing healthcare services, starting from diagnostics, ending up with rehabilitation and follow-up measures. So taking some of the lessons learned from a first panel discussion moderated by Walt Abols, we'll be aiming on and focusing our discussion as an extension of the first one. So basically on the perspective how we create such an ecosystem that would help us to accelerate the process, leaving the patient in the center of the whole process and ecosystem, but attracting also other stakeholders and sitting all together and understanding how we can include everyone on the table to generate additional value out of data. And by this I mean both scientific community, industrial community, governmental institutions, and we'll be speaking not only about Latvian use case, but how we can, as a small European country, take the benefit of it, not only by digitizing our own ecosystem in the country, but also collaborating with the countries and looking for the cross-border collaboration. So with this in mind, I would be happy first and foremost, thanks Krista for introducing the panelists. I will be giving each of the panelists a very quick and brief introduction. So maybe you can share the key arguments on what data utilization and what the interconnectivity, creation of such ecosystem would benefit and would mean to society, to biomedical industry and scientific community. So basically, shortening the question, why we should invest our resources in creating such ecosystem. I think I would start with Ruthie. Hi, Ruthie.
Hi, Emil. Thank you very much for the question, and thank you very much for having me. So I think an ecosystem is kind of the basics and the essence of how we can really be stronger together in these days. I think we all know and we've heard today that the COVID-19 pandemic has impacted everybody and really created kind of like a new set of operational and clinical challenges for the healthcare industry and for healthcare organizations. And everybody had to adjust quickly. And it really emphasized the need for connected views, as we all spoke, right, during these the amazing sessions today, for patients, for care teams, for having a highly secure health data. But most importantly, I think what this emphasized is the high need for collaboration. So, you know, what the pandemic did is accelerated the transformation that started happening anyway in healthcare. And then what it also did is really emphasize the need to collaborate across these different modalities, because really the whole is bigger than the sum of its parts. And the more you bring an interdisciplinary view into the work that you do, into accelerating scientific innovation, into sharing data and analyzing data, and then extracting insights and actions out of that data, that can only be done, you know, by many people collaborating together and by really an ecosystem.
Thanks a lot, Ruthie. Thanks a lot for giving the key arguments and to warm up our discussion. So, Johanna, can you share your key arguments just to start the discussion?
Okay. Hello once again, and thank you for the kind invitation. In general, I think I have 3 or 4 points in my mind. First is the accessibility and availability of data and enabling the effective processing and access to that, meaning citizens' health data and health data in general, by providing better access and better availability. We then hopefully get more research and more knowledge-based management. And as a result of that, we then get better healthcare, better pathways for patients, better medicine, better care in general. So that's motivation for that. Then the second point for creating a better ecosystem would be the data security and data safety. So making clear rules and regulations for the environments where the data can be used improves the data quality and data safety. And then it increases the trust people have in researchers and other bodies using their health data. Then, of course, minor points like eliminating double or administrative burden. So if we centralize, like we have done in Finland, we are on one-stop shop for the Finnish health data. FinData that I represent. So instead of all the organizations and data controllers doing the administrative work, it's centralized in one place. So it saves money and time. And the last point could be improving the data quality. So by cooperating in an environment or in an ecosystem, we can agree on the standards and on the forms for data description and metadata, so that the data in different registers becomes more and more standardized, so it can be combined and made use of in more efficient way. Well, I stop in here, but you see I'm very pro ecosystem.
Sure, we will dive deeper into the case study of Finland, because this is something that amazed everyone once I was, given a glimpse of our agenda today. But turning to Roland, can you, taking your vast experience in diplomacy, give a key argument what it would mean for Latvia to create such ecosystem? So what it would bring us?
Well, it brings us a place on the map of the world, which we need. If you are in research, and I used to be in research in neurosciences, I remember I was studying in France. France research was very good, but if you wanted to be a Nobel Prize, as Guillemin wanted, he went to the United States to do what he wanted to do in France, but where it was impossible. It was to actually obtain a brain hormone. And so I learned that everybody is depending on the others. You cannot imagine in Europe a country which can offer everything in all domains. So we can't have in Latvia experts in all fields. It's impossible. So we have to be part of something. And so what we have to take notice of, we have to declare interdependence. We are in a state of interdependency, and we need each other. But Germany needs Latvia as well. It is not one-sided, it is everybody. So it has been mentioned, we need to be working together for quality of data, for transmission of data regulation. So it is, I heard a lot today the word of collaboration, trust, etc. Actually, it brings back to the human nature, to human qualities.
Thanks a lot, Roland. I think this is what we start to do actually by, organizing this conference. We try to collaborate and get the smartest ideas, the experience from abroad, and digest it smartly to build something here as well. Before we dive deeper into the roles of the stakeholders, we mentioned during the whole conference, and we will be mentioning after the panel as well, the role of the digitalization, the role of technology. So we've seen a lot of presentations today by healthcare professionals stating that, the role of AI in the future, the role of digitalization, the role of distributed systems, etc., as something, that will happen in the future. So I would be happy to give Ruthie and ask you a question just very briefly about the healthcare transformation. So where are we with that now? Are we still waiting, or are we looking for the train which is started to go somewhere and we need to jump in? Can you elaborate on that?
Yeah, very, very good question. So I can tell you, our experience at Microsoft, we've been working on various healthcare products for many years, trying to, bring the transformation into healthcare, and it developed in its own speed. And then the pandemic happened. And then many, many customers came to us and said, we need a system that will allow a doctor to have a virtual visit with a patient now. We need the doctors to be able to access data, patient data from anywhere now. We need a system that will be able to build an isolated ward for COVID patients without jeopardizing our care teams. So what we did is we started taking the technologies that we have, whether they're healthcare related or not, and putting them together in order to help customers accelerate or at least answer their needs very fast. And what happened was that transformation that took, happened gradually over 2 years or more, happened in 2 months. And what we're seeing now is that healthcare organizations really realize that, first of all, they had to deal with the crisis, right? To manage the crisis, to understand how to manage this whole situation with patients, with the volume of data that was coming in and the volume of people approaching the systems. As we heard, even from the minister earlier, that they're basing, the whole COVID responses on a lot of data. So data is used a lot. And at the same time, once healthcare organizations realize that, okay, we know how to manage this crisis more or less, but we get it. Healthcare is not going to look the same in the future. We really, really need to think how we are building the future of healthcare. And we've heard that all along. So the transformation actually is really here. I think it's not when. Healthcare organizations, institutes, ministries of health, pharma companies, life science companies, medtech. It's not about when they transform. It's how and what is the journey and what are the next steps of the journey. It is a journey, and it's happening now.
Thanks a lot, Ruthie. So that's very wise words. I think we need to pinpoint this out as a call to action after the conference as well. So we are not waiting when, we need to know how and why as well. But actually, we were speaking about creating an ecosystem. So the whole conference is about creating such data-driven ecosystems. And I remember myself in 2017, I was, while attending such conference, I was reading the blog of the new legislation in Finland. So our Nordic neighbors actually started off and created a very good example of providing such ecosystem and actually engaging the stakeholders, like clinical institutions, population as well, into this process of secondary use of health data for the sake of research and industrial findings. So I'll be heading to Johanna. Can you briefly share what is FinData is all about and how you got this managed, how you involved clinical institutions in the whole country, plus the population?
Okay. We are FinData. We are the social and health data permit authority in Finland. We had a new act last year in the beginning of May in Finland that is regulating the secondary use of social and health data in Finland and giving the more clear rules for streamlining the secondary use. And the new act also institutes FinData, so it says that the one-stop shop should be instituted. It gives us the legal power to give permissions to almost all the health data that is collected in Finland in connection with the daily healthcare and social services. So the data that is accumulating in connection with the primary use, so to say. Then we have quite actually very wide national registers with long time series and very good coverage. The coverage is almost the whole population. So that's about the database we can give permission to. Mm-hmm. In addition to permissions and after that, we will then collect the data and combine it and give it to you to use in a secure environment. The data is always pseudonymized or anonymized, depending on the case. So we are not giving the direct personal identifiers. You were asking how did it come to that? I think the cornerstones are of course the data and the electronic healthcare system data, also the electronic prescriptions data. All the prescriptions in Finland have been in electronic form, I think, since 2017. So one cornerstone is the good database we have, and the second and the most important is the new act that institutes the data hub and gives the mandate to give permissions and we have also the budget for that. So this is not an initiative or a project. We are an authority.
Okay, so it's not only about the law, but also about the approach, how you engage the institution. Because it was a question of the Valta boss, who is the director of Children's University Hospital. He asked, he would like to have data scientists there. He would like to have people who are able to structure the data and provide the data for the research in order to scale this up, etc. But they lack, apart from legislation, they also lack financial input. And as far as I got from our conversation prior, you also have this model of reimbursement, so you also engage institutions into the circularity of providing your data, but basically covering the expenses for the structuring or any other related work. Am I right?
Yes. Yes, we don't have data, so to say. We are giving permissions to data controllers data, and then after that we collect the data here and do the data management and forward it to the clients. So it's not it's all depends on the cooperation with the data controllers. Without the cooperation with data controllers, speaking about the Finnish hospitals, Finnish healthcare units, Finnish national registers and data controllers, without very good cooperation with them, we wouldn't be able to collect the data and do our job. So we are depending on the cooperation.
Thank you so much. And just the last glimpse before we move forward with the challenges is you mentioned, and I also read and you mentioned in our private conversation that you have very, very enormously high rate of engagement of population. Basically 99.90-something% of population participates there and have provided their consent, their willingness to collaborate. How did you reach this? Because we were speaking about, the lower engagement rates, both in Latvia and Baltics and other countries. What is the golden formula there?
Actually, in Finland, we don't need a consent for secondary use, nor the primary use. We have an opt-out principle what comes to the secondary use. So everybody is in unless they don't deny or prohibit the use of their health data. We have provided, you can see that at our webpage, at FinData's webpage, we have provided the process for opting out, for denying the use of your personal data. And until now, or until last week, we had 180 people that had opted out. Finnish population is about 5.6 million. So in that sense, I can say that everybody is in. So, but the principle is not like it's not based on giving permission, but it's based on opting out.
Okay, so it's based on a combination of things, not only legislation, but also technical ability, giving the opportunity to, giving the ability to do this in the clinical institutions, but also building the trust with society. Am I right?
Yes, that's the key. And as we just discussed, I think it has to do with the cultural traditions and also with the Finnish society. That here in Finland, people tend to trust in authorities. They trust them to keep their data safe, and they trust the researchers to do good research, and then they will benefit by getting better medicine and better care. So that's like the starting point in Finland, that people are willing to share, and they don't opponate this.
Thanks a lot for sharing this. I think this is a very interesting experience we should all learn from. Maybe switching to Roland. So we have discussed a lot that we should change the legislation. We don't have the legislation yet. We should somehow, pivot the vector of development, some of the legal projects. So how hard it is to create a legal legislation change? Is it something that we can create like, a click on and then make it as a top-down approach, or should we actually, sit down everyone on the table and then discuss it first and foremost?
It's very easy to have new legislation. The question is of what quality. So our president said it's the cheapest investment when you need. Thanks to the work done in Finland, we are working on the biobank and on the secondary use of data legislation. And we have studied the Finnish case. So here we understood what is one of the main problems. It's not to write the good legislation. It's already difficult, as I was joking. This is a plan that we have, and we have had different meetings about it. We need it, we understand it, and of course, yes, we bring stakeholders. It can't be a public servant writing that in his office. It's not possible. We have seen before how the patients are getting involved, yes, and they're getting organized. I was happy to hear they're getting organized all over Europe about the Melanoma Association. It is needed, dialogue is needed. But you heard the last idea about engaging in Finland. We have the same mentality basically as in Finland until the Second World War. We were Protestant, trusting, disciplined. But we have had 50 years of totalitarianism. And if there is something lacking in Latvia, it is trust. It is lacking too much. So this is why even more, we need more even dialogue than somewhere else, because we have to create these new ties where we understand that, well, he means what he's saying. What he's saying is what he's going to do. What he's going to do is good for me as well. This understanding has to be somehow refreshed.
Thanks a lot for sharing this. During
Jā, tātad šodien pašā sākumā, kad Latvijas ministre ar mums runāja un Kristaps uzdeva jautājumus, viņš teica, tas ir ne tikai mūsu izaicinājums, tas ir kopējs darbs. Daudzās valstīs šīs institūcijas sastopas ar.
Address this question to Ruthie. So as you elaborated, you had Microsoft had enormous amount of case studies, engaging institutions and different stakeholders in building the ecosystems. So could you elaborate with some of the patterns you discovered, during creating this case studies or industrial projects?
Yes, I'll be happy to. And it's actually very connected to what Roland said, because in order to build trust, you need to show people that you give them value and that you basically empower them, right? And we worked, I think, with thousands of organizations on transforming, right? Their digital transformation, or in general, their transformation. And we have seen a few patterns that repeat. So one was that, first of all, patients, as has been said all across this day, really want better engagement. So how can we enhance that patient engagement? Now, it doesn't have to be patient, right? I call it a health consumer. Make sure that we have better engagement with the health consumer. If it's a better engagement or more engagement between the government and the health consumer, or a pharma company and whoever takes their medication, or a patient in a clinic. So how do we enhance that patient engagement and make them more connected, create that 360-degree view? That's one. And by the way, to get that 360-degree view, you need a consolidated data estate, right? The second trend we saw, or pattern, as you call it, is empowering the care teams and empowering employees in general. The more we give people tools to have them collaborate better, to give insights. Elena mentioned this earlier, if you can focus the doctor on their visit, on the exact things that they should focus on, they're more focused on, the consultation. They are more empowered to do their job better. So the more we empower people, doesn't matter if they're doctors, nurses, operations, administrators, researchers, teachers, ministers, data scientists, the more we can empower them and take time off administrative stuff, the more time they have to do what they're really good at. So, and for doctors and for healthcare systems or for care teams, this means more time in front of patients. That means better care. And then another pattern that we've seen is this, what has been said in here by several people, interoperability. The data, it's out there. It's mainly unstructured. It's mainly not unified. And 90% of the time that healthcare providers spend on working with data, they actually spend it on unifying and structuring it, not on analyzing it. So first we need to unify this data, structure it, and only then we can start analyzing it and extracting insights from it. So having, such a system, as we said, or a common data estate that can unify the data, structure it, and allow to extract not only clinical insights, but also operational insights. It was said here, if we can know how many operations are done, or how many ventilator machines we need, or how many vaccinations we need now, right? And when, right? This could help us predict better, plan better, budget better. So these are the patterns that we're seeing all across, I would say.
So in a nutshell, am I right that we shouldn't be tech-oriented, so we shouldn't be how-oriented? So whether we take the tablet or a phone or, I don't know, blockchain technology or AI, we should be thinking about problems we can solve. Am I right?
Yeah, I come from my background is in the startups world. I used to be an entrepreneur in the digital health space, and it's all about identifying the pain. Elena said this earlier as well. It's all about identifying the pain, the needs, and solving the needs. Technology it comes there, but it's last. It's the how, right? But first we need to think about the why, the what, and then the technology is the how. It's the tool, it's the enabler.
That's a perfect lesson learned. I think we should, especially for non-technical persons who think, of technology as something as a Black Mirror stuff, we should be giving this approach that technology is only like a screwdriver, so we can fix the furniture, and build something that we would like to build there. That's a very good outcome. We should keep this in mind, definitely. We were speaking also about not only the patients coming from a previous panel discussion, but also how we can engage healthcare professionals and researchers in process of using the platform, actually inputting the data and utilizing the data, for the sake of the research, industrial findings, or for sure patient care. So I think a question would be to Johanna, since you managed to engage clinical institutions all around Finland to do that. How did you manage to, this wasn't a legislation for sure only, when you come down and say, hey, you should do it like that. What was the principle of work, of collaboration with the clinicians, so they start using the approach to structure data?
Okay, I totally agree with Ruthie about the allowing the high educated doctors and personnel to do what they are wanting to do, and what they are skilled to do, and what is their best use for the time. But actually here it's the secondary use and the data use for research and development and innovation, teaching purposes. There is no separate collection for data. So we use the data that is stored in electronic health records anyway, when people go to doctors and when people go to hospitals, when people use social services. So it's nowadays all electronic, and so the personnel has to to be able to prescribe medicines, to be able to make diagnoses, to be able to give care for patients. They need to input some data for the systems into the systems anyway, and we are using that same data, so there's no separate load the personnel has to do for the secondary use. And I think that's one of the key points here.
Mm-hmm. Great. Basically, one of the questions that came before the panel from the practitioners is the following. Let me state it. So, while we're waiting for the top-down approach in Latvia of changing the legislation and, bringing transformation in the industry, some of the hospitals have made a step forward by bringing the EHR system, bringing digitalization and their own clinic, which brings enormously good experience, added value, but on a macroscopical level, it brings the fragmentation of data, and because if each hospital would be using their own EHR custom-built solution with their own data structure, we would be fixing this puzzle for quite a long time. So just a quick follow-up to Johanna. So did you approach to the institution stating that you should be using these EHR systems, or was it just a legislation based on the structure of the data and the freedom to choose any of the provisioners of the solution itself?
Yes, I'm very familiar with the problem, and we are here in Finland. So there is, I think, 300 or 400 different softwares used only in the southern Finland hospitals and healthcare system services. What we have done, we have instituted a central electronic healthcare system where now all the units have to store their data. So instead of regulating the software what they are using in the local places, there has to be an what is that in English, an interface or an technical solution where the data comes in a very simple form to the central electronic healthcare system. It's not ready yet, and as Ruthie said, most of the data is not structured. There is, I think, 3 or 4 years already going on the project at our health insurance institution, where they try to put the data on the structured form and describe it and give the metadata. And I think that work is already quite in a way. So we are getting better and better. But there are still cases that FinData has to connect, for example, 20 healthcare systems, and then we get the data, we get the 20 different data, and then we'll try to do the best to combine apples and bananas, as they say. So we are working on that. But there are countries like Estonia, who is, I think nobody is now from Estonia, but they are one step ahead because they don't have this historical load with hundreds of diverse softwares. They had more like a fresh start. Perhaps you are more familiar with that.
So as a smaller country, we have a benefit of actually, changing faster than the larger countries. This is what Roland will also be addressing in the geopolitical view. But before we would step into the geopolitics and actually bring in the value as on a macroscopical level, we have heavily concentrated during this conference on treatment processes, diagnostics and treatment. But another polarity of utilizing the data lays in population health. So how we can start before we actually have any disease that we should be treating correctly. How we can engage population in generating data and utilizing data for the screening activities, for preventive activities, like utilizing various amount of data sources all in one place and making sense out of it. Maybe Ruthie, taking your startup experience as well into account, you for sure know that we should understand the pains of all of the stakeholders, and patients and populations are the one that generate this data. So what's your experience? How do you see how we can engage individuals, society into this process?
Yeah, it's a very good question. Look, I mean, population health in general is all data-driven, right? Because and we've seen this with the pandemic that many of the decisions or most of the decisions we take are fully related, rely on data. Suddenly we hear statistical considerations spoken about on the news, terms that we haven't heard before, which I think is fascinating. Really, there's more and more sources of data, I would say. So beyond the fact that there is patient data and care team data and prescription data and all the clinical data, there's a lot of external data that we need to take into consideration that, maybe, in the past, we used to take it into consideration in our mind when we went to a doctor and they saw us, the holistic person that we are. Today, a lot of what we do is actually recorded in a lot of sensors that we use. So, healthcare organizations also need to take into consideration that we have a lot of sensors that we use, and sometimes we are asked to use sensors. We go to home care. There's what we call Internet of Medical Things. There is, heart rate meters and oxygenation and blood saturation meters and many, many different sensors that actually help us as patients and care teams to better understand kind of like a continuous view of the patient and not a point view of the patient, so that when a patient comes to a doctor every once in a while, they just get a point view. But if they have a continuous monitoring of a patient, leveraging sensors that are not necessarily a medical sensor, but a wellness sensor or a more wellness device, then it gives a much broader and more a richer picture of who the patient is and the analysis that we can do. So, here it depends on the care teams, it depends on the patients, but the idea here is that we have to take into consideration that we have to consolidate a large amount of data sources and different data sources than what we used to be, and standardize them, as Johanna said, and have this an API or something that is able to, take these data sources from different places and consolidate them. But really that consolidated view, and the more patients, are compliant with this data sources, and the more they engage, the more they want to be part of the care, the better picture and the clearer picture that everybody will get.
Thanks a lot for elaborating that. I think we see here the similarity between technical and also diplomacy career. Basically, we need to jungle, as Ruthie outlined, we need to find the consensus between multiple data sources. As per diplomacy, need to find consensus between multiple stakeholders involved. So basically, let us switch to the question. Roland, just in the very beginning, you outlined that we should be thinking geopolitically, not only how we can create a good ecosystem, which is very important for the sake of Latvians, but also to get additional value from the neighbor countries, collaborate all together and receive value for our nation, but also exchange the experience in both ways. So my question would be, so make an ecosystem attractive to, we cannot make this, scalable without inclusion of industry, science, patients, and governmental institutions. So what we should keep in mind in, when we're designing such ecosystem, how we can make this attractive to the stakeholders, how we should do that?
Usually it's when each of them see their mutual benefits when they are doing something. I would say that if I take a bit geopolitically, the COVID crisis, at the beginning of it, there was a kind of a chaotic situation in Europe. The flow of people was, some countries were locked down, etc. And the European institutions were accused of not being forcing that. And at the end of the day, well, the European Union had no competencies in the health system. So it has to be organized. And then the European Union was working on the Genome Declaration, this wonderful notion of common European health data space is now something that we see it's not only needed, it's imposing itself, as the commissioner said before. And so there is one need at this level. Everybody has to be part of it. So what does it mean? That means that the nations, at the national level, we have to get organized in order to be interoperable. By the way, it's not only in medicine, it's also for NATO, for example, the armament of the different armies. But here what I want to say, with the COVID, again, crisis, the nation's meaning, the meaning of the need of the state to get to be caring about their people has been again shown, has been enhanced, and so we had the minister intervene. She's very active. We see that the infrastructure is needed. And we talked also about the transmission of a lot of data, because we have a lot of data. In Riga, we have actually a private initiative, the Genome Data Network, which is also organizing high transmission capacities of data all around the institutions, creating data at hospitals or research centers, and the one actually being able to analyze them with computing. So this is all interconnecting. And then we go to the patients. A patient needs to have good data. He needs to understand that also his data is part of the whole system I've been talking about. We have to, so it was explained here, there is a lot of data, people have to get engaged. It's not easy in our times to explain that to everybody. You know very well that the internet is very fragmented. You have these
the bubble.
The bubbles, etc. And we have to recreate between bubbles interconnections as well, which is the paradoxical situation of internet. So here, it's a bit difficult to answer your question. Everything has to be done somehow. The individuals have to understand that they are part of the whole. And in the last decades, there was a developing trend to individualism. I am myself, I understand everything better from what I see in the internet, etc. We see that it is very dangerous. So this is an obstacle that has to be overcome. So altogether, I see that a lot, and it has been said before, communication between all stakeholders, a lot of human time to be spent to explain things, to discuss like we are doing here, and not to underestimate anybody, any stakeholder. Neither the patients, nor the governments, nor the European Union. Everybody has to be part of the game.
So, in a nutshell, like the follow-up question to finish this point, is it possible to create such legislation that would be both attractive to the industry and scientific communities, but preserving the privacy and added value to the patients?
Well, I hope it is possible, because we're working on it. But we have had, there is this 5G Territory Conference, and then some Germans a year ago from an institution came to here and said, and what's your legislation? So yes, we have to work on it. It has to be well, it has to be clearly understood what are the conditions, secondary use, etc. But it has to be possible. But it goes through errors. Of course, there is the right to err, but at least not too much.
So we have touched base during the first panel on the patient care and patient-clinician relationships. Now we starting to touch base the industrial attractiveness to the industry and to the scientific communities of such ecosystem. So the question to Ruthie, as a representative of a startup world, before now the industrial world, what type of ecosystem, what type of conditions would mean to you that Latvia or the region is attractive to the industrial collaborations?
Well, I think that everything we're hearing today shows that Latvia is an amazing place for such an ecosystem, for such a collaboration. You know, the openness, the forward thinking, the desire, the vision that the president talked about having this common data estate and consolidating all this data. That on its own is an incredible basis and fundamental for an ecosystem, for collaboration. You know, having such an open data system that startups, you know what they need sometimes? They need data to try their systems on because they don't have access to data. So making that data accessible in an anonymized, pseudonymized way is very, very powerful and very meaningful for small companies that want to grow. And eventually innovation comes from many, many places, right? Us, you know, as Microsoft, we have a very big focus on partnerships because we believe that, you know, the power of partnerships is what can really drive transformation and advancement and innovation forward. So we partner also with startups to accelerate innovation because eventually customers buy innovation, right? They buy a solution, an innovative solution to their problems. And that innovative solution needs to be backed by a strong platform, by a secure platform, but also by a good, you know, set of tests that have been done on very strong data. So I think really everything that you've mentioned about Latvia being open, small, agile, I think that's like a winning ticket to success and collaboration these days.
I think that we all here need to be hired by Latvian government's PR agency because we already sold us as a very fruitful country for biomedical partnerships. Roland, you had something to comment on.
Yes, I think there is some important points. The industry has to change as well, and it is changing. I'm happy to be here on the panel with Microsoft, but there are other big companies which are changing. Unfortunately, a lot of people, patients and not yet patients, have the feeling that the companies are only wanting to earn money. But good companies now and in the future are the ones who have a philosophy. They are actually reaching out to the society, to the people, and this is an important change that has happened in the last years. We are the companies only making money are not in. And I think, especially for the young generation, they are not accepting anymore. They want some good philosophy, social economy, things like that. So this is a point I wanted to stress.
That's perfect. So we should find this balance and also invite everyone to create innovation or to create added value.
And then there are stakeholders like everybody, yes.
Every player means in this game. Sure. So before we move to the finalization and the lessons learned and sort of call to action from the panelists, let me quickly address a quick question to Johanna. So we just started speaking about inviting industry and engaging industry and utilizing the data, meaning benefits to them, but also to the ecosystem. So as far as I got, FinData is also have partnerships with the biopharma, scientific communities, not only in Finland, but also outside. Am I right?
Yes, we have customers both from Finland and outside from Europe.
I think that's very interesting. That's a very interesting lesson learned because we should not only perceive the ecosystem as something direct, patient to clinician, or society member and clinician, but also industry, academic, all around the world, and utilizing the data for both of the ways. So before we move forward, so basically we will be we'll be talking now about the key formula from the panelists, the key formula or key takeaway in order to make this approach happen, in order to basically, after starting today, we'll wear masks and fight the pandemics, but once we fought the pandemic, in parallel with that, we will starting working on the ecosystem launch and the development of the legal framework and also industrial framework. So what would be your key formula or takeaways to address to our stakeholders in Latvia to make the things happen. So let me start with Johanna.
Well, perhaps I'm repeating myself a little bit and giving you the Finnish way to do things, but first of all, you have to have clear rules. You have to streamline the process, and that's we are talking about the legal basis then. So what pharmaceutical industries, for example, what they want the rules to be clear. So you need a regulation for that. And then you need, I think, one contact point, especially in the very small countries like Finland and Latvia are one contact point per country. And then if those hubs, data hubs, can then interact and cooperate with each other, that's even better. And then you need what is very popular in our operation is the help desk. So we have a single contact point help desk where you can ask about the availability, about the quality, about the coverage of the data, of the Finnish data. So that has been used by the stakeholders really a lot. So it has proven to be very popular.
Thanks a lot for elaborating with that, Johanna. Ruthie, may I ask you to share your key takeaways or call to actions?
Absolutely. I think what we've realized also from our experience is that transformation is a journey. I even say that the transformation journey has 4 main pillars. First of all, a vision and strategy, and I think that's in place. Second is culture. Exactly what Roland said, it's about bringing value, it's about being inclusive, it's about being diverse, it's about being open to collaboration and really thinking about the value that you bring, about empowering people, right, which is our mission and our North Star. But I think, everybody really understands today that you really need to bring out the positive and the good value, and a culture, an open and inclusive culture is part of that. The third pillar, I would say, is a unique potential, right? I always used to say that to startups as well, but this is true for anybody. It's true for a person, it's true for an organization, it's true for any system. What is the unique potential you're bringing? What is the unique value that you're bringing? And finally, it's capabilities. We talked about, bringing data scientists into hospitals. So it's true, 50% of health executives say that, their kind of blocker to transformation is lacking skills, but not only medical skills, but also data science skills, analytics skills. So how do we, identifying what are the capabilities, the resources, the skills that we need in order to transform? And then finally, I think it's really being very practical, starting as a first step. Once you've landed these 4 pillars, start with the first step. Reach out to whoever you feel like there's a connection and you could do something with, and start with something. And then everything will start. Just take that first step of that wonderful journey.
Thanks a lot for sharing this vision, Ruthie. Both of us, I think, taking notes, and also people on the background taking notes. So, Roland, what would be your takeaway on this starting this journey?
Well, I'm not Buddha, so I don't know about the first step, but I think we had the Children's Hospital today, and this is one step, a pilot project, which I see as a major thing for the Latvian pediatrics. The digital transformation of the Children's Hospital is, for me, a pilot project. It is a national reach out. It will mean also for the regions, everything that has been mentioned. And then I would like to say everything that Ruthie said and everything that Johanna said, but I will then not say that, but introduce a notion I read, collective intelligence. It's a book, Clés du Futur, The Keys to the Future, written by a Latvian background French thinker. And he explains in Morocco, which is, I used to be non-accredited, non-residing ambassador to there. I know a bit the country. And the biggest exporter is phosphates. In phosphate, I think the big exporters in the world, 26,000 employees. And about 10, 15 years ago, there was a new CEO. He had to change the mentality because they were losing about 7 billion a year or something tremendous. And he did. And what did he do? He actually gave some space. We were talking about empowering for people to engage. So there were people not in the hierarchy among these 26,000 people, engaging with people in the hierarchy if they had an idea. They developed the ideas, so there is no point of, it's an individual engaging in a common process. He gets responsible. We were talking about responsibilizing the patients. It is the same idea. Everybody is part of the process. So if Microsoft here is very active in Latvia, I'd like to work more, but the Children's Hospital is working with Helsinki, more with them. If we all are together with a certain humility and work and see that the news idea for somebody who has no knowledge maybe, but the idea is good, we take that into account seriously, well, then this is how we can change things, certainly.
So collaboration and basically joining this journey
And
all
respect
together.
to each other, respect of people who have maybe no experience, of people who have too much experience.
So we should find the golden middle point there.
Yes, a balance.
Thanks a lot, dear panelists. Just to quickly wrap up, so basically we would be happy to join all of you, all of the our online viewers and also the panelists and the speakers to join to this journey all together, first and foremost. The second of all, the outline for myself is the right framework, which is the legal framework, which is friendly, attractive, preserving privacy, and giving space. So not basically penaltying people from the first perspective, but basically giving the space to understand their capabilities and to join forces. Technical framework, which is a vast experience. This is what all of the panels were mentioning about, that we need to start with very good structured data, the scalability and the framework to understand how we can play around. Comparing apples and bananas, as Johanna mentioned, and communication framework. We should speak. I think this is a golden formula from the whole conference. We should speak even more than we're speaking today. So yeah, we are wrapping up, so we have 10 seconds left. Thanks a lot, dear audience. Thanks a lot, the panelists. So I hope to meet you soon in person, and let's hop on this journey all together. Have a perfect day. Goodbye.
Thank you very much.
Thank you.
Bye.
Bye-bye.
Bye-bye.
Thank you.
Thank you, Krista.
Thank you, everyone. And thank you for the fruitful discussion.